Hi, I'm Dr. Philip McMillan, and I have been tracking disease patterns over the past 6 years since the onset of the COVID pandemic. And I have been looking at what's been happening recently with regards to hospital episode statistics and admissions. And I think that it's indicating something pretty significant with regards to what's happening across the board in populations. And what I'm going to be talking about today is a case report. Now, a case report is usually published and it's shared by doctors or scientists who think that it is unusual enough to share the information publicly. And in this case, they were looking at a condition called tubulointerstitial nephritis. This means kidney with uveitis, inflammation in the eye, TINU syndrome, following COVID vaccination in an elderly patient. It's important to not get too hung up on the source of spike protein because what I'm looking at are patterns that are occurring or what I'm predicting are occurring with regards to reinfections. What a lot of people fail to understand is that if an immune system has been primed, and then gets exposed to spike protein again and again, it can lead to unusual manifestations of disease. And so, in this particular case, this is a rare published report where they looked at kidney damage and eye damage occurring around the same time. Many people will say that, well, that's just rare. That's not how I look at it. I look at a spectrum of disease, meaning that what you see in a case report is at the far end of the spectrum, but you will have lower levels of presentation that could explain mechanisms of disease. This is what I'm looking at, and this is why I think that this is so important. So, before we start, just to give you a quick idea as to how the kidneys operate, here we have a picture of a kidney. Now, you have two kidneys, one on either side in the flank, lower back region. And what you have to remember with regards to the kidney is that it filters the blood. And you have in the middle here a glomerulus. And this is where the blood first comes. And then the plasma is filtered. So a large amount of it gets into what we call the proximal convoluted tubule. And then most of it is reabsorbed. And then it goes down and it concentrates the urine. Well, it concentrates what's been filtered until you pass urine out, which then goes out of the kidney to the bladder. This essentially filters your blood multiple times over. And this is how you try and keep healthy. So the kidney is very, very important. And when we're thinking of this case, I want you to focus in on a particular part of this kidney or this glomerulus. And when we look here again, this is a picture of the glomerulus where the blood comes in, blood goes out, it filters it here, and then most of the absorption happens in what we call the proximal convoluted tubule. This is where we're going to be concentrated because in the case report, this is the part of this nephron that was most affected in this patient. And I think that there is something very important to learn when we look at the analysis. So let's come into what was done. And this was done by the Japanese. So far, I found that the Japanese tend to be the only ones who are really asking hard questions, doing autopsies and histology, trying to make sense of things. So here is the case. And I'll jump past this abstract bit and I'll just go into the case report. The patient was 70 years old and he had a history of high cholesterol. And he had been managed by that for at least a year. So he's essentially okay. He had no prior history of kidney disease, he had no allergies or relevant family history. And it's important to note that he was only on a statin, domperidone, and another medication here that he had been taking for some time. This is the important bit. So, 3 months prior to the referral to the kidney department, he had received his third dose of the mRNA 1273. That's the Moderna COVID vaccine. Now, this is really important. A few weeks later, he developed anorexia that persisted despite treatment with gastrointestinal medication. Now, you'll notice here the domperidone has been added, and this is probably because he may have had some nausea as well in relation to it. But prior to this, it seems as though he was only on a statin. So, what I want you to remember is that he developed symptoms a few weeks after, which didn't seem to be connected. However, 2 months or at least 6 weeks after these symptoms, working efficiently. And that was the onset of the renal failure. And as you can see, this is the Department of Nephrology in Fukuyama Red Cross Hospital in Japan. And that's the initiating phase of the disease. And so they were doing a lot of investigations to try and understand what was going on. And for those who are interested, you will see they stopped his medication. They went through all the investigations. His physical examination was normal. The blood investigation showed an elevated creatinine and urea. His kidney function, EGFR, glomerular filtration rate, was 17. That's pretty low. His inflammatory markers were very slightly elevated. But other than that, all of the autoimmune screens that they did were negative. It showed that he had protein in his urine as well. And critically, there were some injury markers that were markedly elevated. And these ones, NAG and beta 2 microglobulin, were exceptionally high, which is why we know that it's likely to be the proximal tubule that was involved. So this is the starting point with regards to what was going on with this gentleman. Now, you have to remember, this is 2 months down the line from when he had his third booster. And remember, the sequence is he had no problems with the booster, but 2 weeks after, he started to have gastrointestinal symptoms, primarily anorexia, for which they put him on some medication. Then 6 weeks later, he was found to have abnormal kidney function. Now, we don't know if that was a routine test that they did, but it seems as though that was relevant. When we look at what they found, when they looked at the biopsy, so they took a sample of his kidney, they found that there was predominant CD3 positive and CD5 positive T lymphocyte infiltration. So this is what we call cell-mediated immunity or autoimmunity. And it was primarily lymphocytes in and around the kidney. There were some macrophages, but this is suggestive of a cell-mediated response. So it's like a delayed autoimmune response where the immune cells that should be targeting other things end up targeting specific parts of the body. And in this case, it was actually his kidneys. Now, here is the very interesting part. And this is what caused this to end up being a case report. Here they have, he developed bilateral eye pain or ocular pain, for which he sought ophthalmology evaluation. And what they found were findings consistent with active anterior uveitis, that's inflammation in the anterior chamber of the eyes, extending to his iris and lens interface. And so he had bilateral uveitis, which would suggest that this was probably autoimmune. So again, let's go through the sequence. He first has his third dose. 2 weeks later, he has gastrointestinal symptoms. Now, I cannot emphasize to people how important it is that most of the research that I'm seeing these days are pointing to gastrointestinal problems and pathology as the driver for many of the patterns that we're seeing. So after the gastrointestinal complaints, he then went on to have renal failure. So his kidneys shut down. That's about 6 weeks later, they found that. Then, about a month later, he then has eye pain and is found to have inflammation of both of the anterior chambers in the eye. And this is what led them to confirm this diagnosis. And the name here is, well, he had tubular interstitial nephritis and a subsequent onset of bilateral uveitis. The diagnosis was tubular interstitial nephritis and uveitis, TINU syndrome. This is a very uncommon syndrome. And when they went looking for any other episodes of vasculitis, they couldn't find it. And this is part of the reason why they ended up writing this case. And this is what his eye looked like. So this is the iris here. And you can see that it seems as though there's some damage and inflammation inside the pupil. And you can see at a different angle here, the iris is damaged and inflamed. And it's the front chamber of the eye that actually was affected the most in this case. Very unusual. And it raises the point, as I said, that what we're looking at are spectrums of disease, not necessarily just the fact that you have a rare condition, because this is clearly a rare condition, but what happens if you have less intense inflammatory processes occurring that involve the kidneys and potentially the eyes? Now, this is where we're coming to what I think is the very important aspect of what it is that we are doing. When I looked at the kidney data, and as I said, I've been looking at this data now for a number of months, and I've been following COVID for over 6 years. When we look at the data coming through with regards to this here, what we have got is a situation where you have significant elevation in some markers for the kidney. And you can see here, in the age group 30 to 44, we see a 158% rise in the inflammation of the glomerulus. This is very unusual. 95% increase in the 18 to 29s. This is really fascinating. The only group that showed a decrease in acute kidney injury was the over 75s. So across the board, we are seeing patterns with the kidney that suggest that the kidney is being damaged. Now, to analyze what happened in that case report, I then did something else. I then thought, well, if this is a pattern and this is relevant with regards to this kind of autoimmune process, if it is occurring broadly across the population, then we should also see a rise in inflammation of the eyes, uveitis. So I then went about looking, and this is what, therefore, I would have found. When we look at the signal for post-pandemic eye diseases, and these are NHS hospital episodes, you can see it's relatively stable here, fell in 2020-21 because of the pandemic, and then a sustained rise, and it flattened here in 23-24, and it's hovering at a higher baseline than before. But this is all eye-related conditions. When you break it down, and you can see these lines, these are harder to see, but if you look down at the top signals that we're seeing, straight at the second one here is acute and subacute iridocyclitis, or uveitis. We are talking about a 73% increase in terms of this occurring. And this is completely in line with what we're seeing with regards to the kidneys, and as well what we're seeing with regards to the intestines. All three rising together in a similar pattern. This is why I'm saying that what we're doing in the next few days, or tomorrow actually, is we are looking at the COVID's hidden trigger. Why are kidneys failing? That's what I'll be covering in the next day, looking to try and explain why we're seeing these patterns. One thing that is certainly coming out very strongly is this autoimmune kind of picture that seems to be occurring. When we look at what is happening across different age groups, this is pretty small, so you can't see it, but 0 to 14 is here, they are stable. 15 to 29, they had a 200% increase in chronic iridocyclitis, uveitis. And you can see 30 to 44, 84% increase for chronic. And you can see that across the board, we are seeing changes in different age groups. And if you want to be in touch with this information, this is why I put together the post-pandemic trajectory, looking at the snapshots of different conditions. By the time I'm finished doing this, I will have almost every system analyzed. I've so far done cardiovascular, I've done neurology, I've done liver, I'm doing renal, I've looked at immune privilege dashboards as well. So everything sequentially, looking at the patterns, trying to make sense of them. This is not straightforward, and I don't want you to think for any moment that just because these trajectories are occurring, it means absolutely that this is a problem across the board. What I say to people is that this is such a strong signal, because if people are being admitted at increasing rates, it very much suggests that you have a very high rate across the population where they didn't need to be admitted or didn't need to be referred, but are having similar kind of pathological presentations. So what I would say here, because I just want to make sure that you understand one final point with regards to what is happening here, is when we look at which part of the kidney or the nephron has the highest levels of ACE2. One of them is the proximal convoluted tubules. This is exactly where the damage occurred, as well as the blood vessels coming into the glomerulus and the blood vessels around the tubules. This is exactly where we're seeing the inflammatory process occurring, and it could therefore explain why we're seeing all these conditions rising in a similar way at the same time. As a final reminder, in case you had joined us late, this is the summary of the case. This is from Japan, a 70-year-old man who had a history of high cholesterol, had 3 doses of the Moderna vaccine, and after the 3rd dose, a few weeks after, he developed anorexia and other needed gastrointestinal medication, which suggests he probably had some nausea as well. Then 2 months after, he then had renal failure. And then a further month later, he had bilateral inflammation of the eyes. Now, it's very important the paper makes sure that it says this, even though they thought that this was likely to be the mechanism. They've made it clear in the paper, causality cannot be definitively established. They are just presuming the likely possibility, taking into consideration ACE2 receptors and them being targeted potentially by the immune system. The point that I'm making, and I have said from the beginning of the pandemic, if you underestimate autoimmune responses, it is like the silent killer, and it will continue to cause damage across the population if we don't figure it out quickly and find ways to help patients. This patient was saved by the fact that he was given high-dose steroids and a tapering dose over about 3 to 6 months. That helped his kidney function get back to close to normal. Imagine how many others are being left to just deteriorate with no intervention because there is so little understanding of what is going on. Have a great evening. I'll continue to bring you interesting and updated science.